Hey, it's Jessica DaMassa with WTF Health. I am here with Lauren Weiniger and Ken Mayer, and they are co-founders of the Safe app, which is really the safe sex app. And so what this does is it lets people show their verify STD status on their phone. So talk to me, I guess, about this space. Why do we need an app that shows our STD status on our phone? Why do we need this space disrupted?
Well, sexual health is a massively underserved, overlooked market. STD rates in the U.S. and globally have reached a new all-time high for the fourth year in a row. And there's never been a simple, easy solution for people to know their status and to confirm their partner's status. So what Safe does is just makes it super easy to do that. You can import your status for free from anywhere. I do not care where you were last tested. You can show your partner on your phone. And then if you need to get tested, you can book testing through the app, and it's cheaper, easier than anywhere else.
How do you hope that this is going to shift the conversation around this? I mean, because it's kind of like, I mean, it's a cool idea. I like it, but it's kind of like, okay, now I'm going to show you my phone and my STD status. Is that, I mean, how you have to kind of, I think, pivot the mindset, right? So how are you guys going to do that?
Well, the idea is to kind of remove the awkwardness of it, and by being able to just have an app that you can quickly pull out and to kind of remove from the discussion even mentioning STDs, or what people mostly ask now is, are you clean? Have you been tested? And they don't even wait for a response. Yes, I've been tested, but tested and the results were what? So with this, it kind of makes it just simple and easy. Just show me you're safe, and kind of makes the conversation much more sort of accessible and easier to have.
And now the information you had said is coming from electronic medical records, right? So talk to me, I guess, about that process. Like, what does that entail exactly?
So SAFE connects directly to electronic health record systems from the major healthcare systems so that we can import the person's results from wherever they were tested. Pretty much any physician, clinic, or lab are connected into these systems now, and we've worked out a way to connect into them and to be able to import the results for free in real time in most cases.
Okay. And so how many users do you guys have right now? Do you have a lot of users on this?
Well, so we capped users at 3,000. We got 2,000 users the first day we launched. We did a little activation at Coachella, so we definitely proved the demand. That's definitely where our market is. And then just doing small marketing tests. We are turning on the really incredible part of the system at the end of this month. So that's when the marketing machine really comes to life. We've got college ambassadors lined up across the country that are super excited, as well as celebrities and social media stars that are really on board with supporting this movement. It's really all about empowering people, particularly empowering young women in the LGBTQ community to take control of their sexual health, to demand transparency from their partners, and to not take these risks that could have lifelong consequences.
Talk more about that, because I mean, like, I think you are kind of starting a movement here, because I mean, this is really changing and taking a very intimate conversation out of perhaps a bedroom and putting it on a phone. Do we really need to have this conversation on our phone? Like, I mean, tell me about the benefits of it, I guess.
Well, I mean, right now, more than ever, I mean, STDs have reached an all-time high in the U.S. for the third year in a row. 1 in 5 of your potential partners has a chronic, incurable, lifelong STD. Even HIV, which was on its way down, among teen girls is up 24% over the last 2 years. And you can kind of see that track with the proliferation of the dating apps, which have made casual sex more accessible.
Okay.
Like, if you Google fake STD test results is the thing, you'll come up with pages and pages of these fake patient portals. So people are already scared, and many already asking to see partner status, but there's just never been a trusted way to do so. So that's what we're offering. It is a slight shift, but what we're doing is we're really talking to, every relationship has a gatekeeper. One person wants to engage with the other a little bit more.
Sure.
So particularly among younger populations, it tends to be women, and that's why really the marketing goes towards them. But all we need is to convince them. Then that other side, in many cases the younger guys, it's more of a FOMO play. If you are worried that you are not going to, say, seal the deal because you don't have this very easy app, very free app to have on your phone, well, then are you going to risk that? And if you get turned down once, you're a member for life, and you're going to tell all your friends.
So let me ask you this then. So where are you guys at from a business standpoint? So I mean, you said you're unleashing the marketing hounds here soon. Things are going to go crazy. They're going to go viral. You have celebrity support, whatever. But so talk to me about where you're at. Are you guys are you raising money right now? How are you funded? Who are you selling this to? Who's your client?
So we've raised $2 million so far. We're closing out the seed phase with another $1.5 million that we're actually up here closing, and then plan to do a really large Series A early next year. we're basically servicing the end user, the consumer, and the app is free. And how we make money is we have deals with Quest and LabCorp that are the two biggest diagnostic labs in the country, and people can book testing at over 30,000 different locations across the country and use their insurance to pay for it. So in order to enable that, we had to build out a national network of physicians. So in the app, there's a little questionnaire that mimics a physician consultation, and it allows us to chart medical necessity. And there's technically one of our physicians standing behind it that prescribes the test so that your insurance will cover it. So anybody who's insured, this testing is, free.
That's really cool. That's an interesting model too. I like the fact that it is very much paid for by your company, and it's actually really creating awareness for STD testing as well. I mean, of somebody's individual status, but it is really doing that.
And it makes it easier. Right now, for many people, it's access to testing can be difficult. Even if you have insurance, you have to make an appointment at your doctor. Not everyone wants. Planned Parenthood is amazing, and there are amazing free HIV clinics in particular, but it's not accessible to everyone. With this, they can skip the doctor, just go straight to a lab, not face their doctor. You don't necessarily want to, your lifelong doctor talking about this stuff. It's awkward for some people. And again, it's the cheapest option for everyone. So, when people have insurance, they're paying their copay, cool. Insurance pays us a lot of money for something that only costs me a little. And then if they don't have insurance or they don't want to use it, it's just a flat $99, which is a half or a quarter of the next cheapest option out there.
That's fantastic. Well, thanks so much, you guys, for stopping by. It's really cool to hear about this. Good luck with your marketing ramp up, the official launch, I guess. I mean, even though you are launched. Very cool. I'm Jessica DaMassa with WTF Health here at Health 2.0. Thanks so much for joining us.